Hello and welcome back to another episode of Taking Control of Cancer, the podcast brought to you by the North East London Cancer Alliance. Whether you're going through cancer yourself, maybe a loved one's going through cancer, maybe you work in the field of cancer, maybe you're a healthcare professional, we hope this podcast will give you plenty of guidance to help you take control of your cancer. Because while we know that not all cancers are curable, there are things that we can all do to help ourselves and the people around us. This episode is all about tackling the menopause and cancer. We're going to go through some of the big questions that you might have, tackle some of the big topics, debunk some of the myths. We're also going to go into some of the places you can find support. And one of those places is an amazing charity called Menopause and Cancer. And my guest this week is the founder of Menopause and Cancer, Dani Binnington. Now, Dani is a broadcaster. She is a podcast host. And as I say, the founder of this amazing charity. She was also diagnosed with breast cancer herself in her early 30s. So she knows all about the challenges. So this is my conversation with Dani. All right, so Dani, welcome to the podcast. We're talking about menopause and cancer, and it's not a topic that I know a lot about, and I'll be honest about that, but that's probably not a bad thing, that we can start to have a conversation that covers the basics, a bit of an idiot's guide, because of stuff that I don't know, I'm sure other people won't know as well. So before we start that, let's go into your background. What is your background and how did you get involved with menopause and cancer?
Well, thank you for having me. I think we all need to talk about the menopause, whether you're male, female, and also if you have been affected by cancer. When I was going through active cancer treatment, when I was 33, my period stopped. But I think my oncologist then said, you will lose your hair, you might have, other side effects of chemotherapy, and you might lose your periods. But I never put two and two together, and I never knew that I was actually in the menopause then. It was just my period stopped. And my mum always said, you should have paid more attention in school, Dani. You should have known, but I didn't. And I think a lot of people don't know much about the hormonal health.
Was that taught in school?
I don't know. So you didn't pay attention in school either.
Evidently not, but I don't know if it would have been taught in school.
I think I realised I knew very little about maybe my own health as a woman, my women's health in general. Anyway, my period stopped and mine did come back. I was very lucky. I had 3 daughters already. They were little, and so I didn't have to worry about infertility. But I know a lot of people are worried. Are my periods going to come back? I might want to become a mother. My periods came back. And then I lived a happily life with my periods for the few years after my initial cancer treatment. But what happened to me then is my doctor said I'm a genetic mutation carrier. And they advised me to do maybe something about higher risks of ovarian cancer and more risks of more breast cancers. And all of the women on my dad's side of the family died of ovarian cancer. Right. 2 aunties, my granny and great-granny, way before they even turned 55. And so I was the first one in our family to know that there is a genetic issue. So I thought, well, this is a bit doom and gloom. What am I going to do? So it was the right thing for me to have a risk-reducing double mastectomy. And I thought, well, I'm ready to let go of my boobs. They'd given me cancer. Thank you very much, have them. And I embarked on it like a little project. I chose my surgeon. I chose, am I going to have reconstruction with implants, or am I going to go flat? So I made choices. And then as I was nearing my 40th birthday, I realized, how lucky I was to be alive, to be able to make these choices. And then I let go of my tubes, ovarian tubes, because my doctor said often ovarian cancer starts in the tube. So I let go of those. And just before I turned 40, I then let go of my ovaries. And I thought I'm going to tackle the project in the same way as my double mastectomy, but it was a completely different story. No one talked to me about how I was going to manage early menopause as a young woman. And so that's where everything started, my quest to figuring out what can I do about this, what am I going to do about my symptoms, but also my long-term health. How do I want to live? And that really opened this whole box, and it led me to setting up the Menopause and Cancer podcast, but also then the not-for-profit organisation, Menopause and Cancer.
So how many people do you work with and support through the charity?
Well, so initially, remember, as that patient trying to figure out, I thought it's just me and maybe a handful of other people. And in my first Facebook group, we were thousands of women from all over the world within a few weeks. And now on the podcast, we have tens and thousands of people listen every week. And as a community, as an organization, this year alone, we've supported over 3,000 people in online workshops.
Wow.
And it is now our mission to bridge that information gap. And so we bring experts to our community. That's what we really want to do, is share their expertise, that there is help, that there is hope. There is lots you can do, and we just want to bridge that gap.
Let's go back to your diagnosis then at the age of 30, so a few years ago now. Obviously, things have changed a little bit since then. Your group obviously wasn't around then. But what, if any, information did you get about the potential changes to your body? Anything to do with menopause at that point?
So I queried it because I knew from the menopause conversation out there that early surgically onset menopause wasn't just going to be no big deal. And so when I queried it, I got very different opinions from amazing doctors. All of my care was in the NHS. All of my doctors were amazing. For some, hormonal health after cancer was more on their radar, and they said, you will have symptoms, it won't be easy. And then when I said, what am I going to do about it? They were like shrugging their shoulders. I was like, that's not good enough. Some said, let's wait and see. Others said, yes, it will have a really negative impact on your bone health, brain health, and heart health. Full stop. And I was waiting for them to say but they didn't. And so I had to go and look for that but. And often it was at 3:00 in the morning on Dr. Google, which I know we shouldn't be doing.
But everyone does.
But everyone does. And I went down many rabbit holes. But there are some incredible experts out there, some leading menopause and cancer specialists in the NHS in this country. But a lot of them aren't even on Twitter or LinkedIn. And so I wanted to bring their knowledge to the women in my community, and that's what we do.
But it's hard at that point when you're first diagnosed, and I think back to when Rachel, my first wife, was diagnosed. All you're thinking, I think, is get this cancer out of me.
Yeah.
Cure the cancer.
Yeah.
And then we'll figure out the rest afterwards.
Yeah.
But actually, in hindsight, that's probably not the way to look at it, is it? Because actually the impact of all the other things that come with cancer are in many ways just as severe.
I think it's the only way we can manage, and it's going to be very different for each family, each person. And if you're supporting someone, you're going to have different ideas than if you're the affected yourself. Me and my husband going through this, I think we were quite close as a team, but each one of us felt extremely lonely in our own experiences. And we were a good family unit. And so I think everyone's experience is so different, and the best you can do is just get through the really difficult times. And all you want to do is see the other end of cancer treatment. And the same is true for your oncologist. All they will want to do is to keep your cancer at bay, to treat your cancer, or to help you stay on your cancer treatment, if it's for secondary cancers, for as long as possible, right? And at the same time, whenever we are curious and ready to think, I've still got all of these symptoms, and I want to talk about those in a minute. What are the symptoms of the menopause? Or I can't sleep, I've got hot flushes, I've got anxiety, I've got terrible joint ache. And you're wondering, could this be because of maybe the menopause after cancer? And you want to live better. We all deserve also to look after ourselves and come to a place with good quality of life, isn't it? Because what many people say to me, they say, Dani, is it a trade-off for having survived cancer? Do I have to feel this rubbish because I'm alive? And there is an aspect of that. But I want to challenge that because there is much we can do.
It's really difficult, isn't it? At the start, when you're first diagnosed, your head's completely scrambled, isn't it? And I think, as much as it's easy to say you should get all this information about everything at the start, I don't think your head could process it all.
No. And I don't think we have the capacity to process it all in one go. And so when we now have conversations with lots of oncologists and surgeons as an organisation, with breast care nurses, we often say, when is it the right time to talk to a cancer patient about the impact of menopause as a result of their cancer treatment? So we know surgery pushes you into menopause. Chemotherapy can do that. radiotherapy to the pelvis, but also for some breast cancers or hormone-dependent cancers, sometimes people are on endocrine therapy for 5 to 10 years. It's a long time to have debilitating symptoms. And each patient will process things at a different time, right? And so perhaps what we have identified are 3 key areas. The first one is the real lack of preparation. So perhaps mentioning that this might be part of some survivor's story is really important, because people feel a bit fobbed off when they sometimes realize 3 or 4 years in what they are struggling with and that they had no help. And then also that there is a lack of acknowledgement that menopause after cancer can often be more severe in terms of symptoms, can come on really quickly, like after surgery, you're pushed off that hormonal cliff. And actually, yes, symptoms are more severe. There is no help because no one talks about it. And then there is lack of support, because if the first 2 aren't in place, you're not going to get the support you need.
You touched on it a little bit then. Let's talk about some of the symptoms and some of the, the facts that we know about menopause as a result of cancer treatment. What are some of the symptoms and some of the things that we need to know?
I think before I go into them, and I'm going to read them off so I don't forget any, because I really want to acknowledge that if anyone is listening or helping a patient or going through this themselves, that the list is quite extensive. But what I want to say is people might experience some of those symptoms or all of them or none. I have never had a hot flush in my life. I don't know why. But I had many other symptoms. And some people might be, dripping with hot sweats. And so you never know which symptoms you're going to get. And also I want people to know they're never stuck, because these symptoms, they will come and go in waves. Whatever people are experiencing now when they're listening to this, please don't feel you're always going to feel this rubbish. Some symptoms you can get treated much easier than others, but let's look at them. Anxiety is a really big problem for all cancer survivors, but with the lack of estrogen, anxiety can be really compounded. So we know for healthy perimenopausal women, anxiety also is one of the most common menopausal symptoms. Mood swings, irritability, low mood, depression, lack of motivation, tearfulness, loss of joy, reduced confidence, brain fog, fatigue, poor memory, poor concentration. And when I say brain fog, cancer survivors will think, I don't know if I've got brain fog, or is it still chemo brain?
I was going to ask you about this, because I'll let you get back into the symptoms. In fact, you finish the symptoms, then I'll ask the question.
Yeah, don't forget.
Go on,
Difficulty sleeping, so either people can't fall asleep or they wake up in the middle of the night and then that's it. Loss of libido or total lack of libido, night sweats and hot flushes. Headaches, heart palpitations, migraines, tinnitus, the feeling of being dizzy. Changes to periods, vaginal symptoms, reoccurring UTIs and urinary symptoms. And I want to talk about vaginal symptoms a little bit more, because it's not just vaginal dryness, it's lots and lots of really painful symptoms, all the way to painful and bleeding intercourse. And so women really need to know that all of those symptoms are part of menopausal symptoms. Dry itchy skin, dry ears, dry nails, thinning hair, oral health changes, weight gain, restless legs, joint or muscle pain, increased allergies and digestive issues.
Wow.
Sounds depressing.
It's a heck of a menu, isn't it, of symptoms. What I think is interesting, is that how do you know if some of those are menopause or getting old or as a result of cancer or the many other things that I'm thinking of myself in my 40s, and my wife's in her 40s, probably has a number of those, and she's never had cancer. So how do you distinguish between what might be a sign of the menopause and what might just be something else?
It's really difficult, isn't it? And that is why we feel so passionate that we talk about the menopause after cancer being an important issue to address, because we have, as I said to you earlier, we have many people in our younger communities. They're in their 20s and 30s. They might have been treated with strong stem cell transplants for like blood cancers or bowel cancers. They have no more hormones and they experience whole suitcases full of symptoms like that. And they often scratch their heads and think, is my cancer back? I've got hot sweats. Is it something else? People say to me, I feel like I've got ants crawling all over my skin. I am going mad. And so the first thing to acknowledge is ask your doctor, is this cancer treatment likely going to put me into the menopause? And what does that mean? So with surgery, yes, once you've got no more ovaries, you'll always be in the menopause, in post-menopause. But it's really important so that we don't think we're going mad, so that someone acknowledges this can happen to you. And sometimes the best doctor in the world won't know, is your severe anxiety and panic attacks or your lack of sleep due to you having had cancer, which is a life-altering event for everyone with that diagnosis. You will feel anxious. And is it also compounded by your lack of estrogen? Possibly. What I want to say is, you don't need to know. If it bothers you, if you have these symptoms, if they stop you from living a good life, you deserve help.
Yeah.
Just because you've had cancer, just because that cancer treatment pushed you into the menopause, doesn't mean you shouldn't do anything about your anxiety.
So your first point of call with some of these symptoms would presumably be your GP. Would it be your GP, or would it be your team at the hospital?
Yeah.
So I'm thinking, if you went to your GP, not to kind of criticize primary care at all, because they're fantastic, but they've got such a lot to look out for, haven't they? So how do they distinguish, and are they good enough at distinguishing the signs of menopause?
I think we need to start to backwind a tiny bit and really start with ourselves, because at the moment I speak to so many different policymakers, doctors, oncologists, patients, and what I hear is the care is very different in different parts of the world and the country and places. Hormonal health is on some people's radar and not on others. It's really to sit down with yourself, if you think you have been affected by the menopause after cancer, with a symptom checker. You can advocate for yourself in the best way when you really know what's going on for you. We have one on our website on menopauseandcancer.org, and it's a simple PDF where all of those symptoms I've just read out are listed. Have a cup of tea and sit down with yourself and think, what is really going on in my life? Because sometimes we're in such a mess in our head. We go to the doctor and it's like coming out of us, and we don't know what we want ourselves. And then to think, what is it that bothers you? Do you need help in managing some of your current symptoms, like hot flushes, leg weight gain or restless legs? Or are you worried about your long-term health? Because many people say, I know now, because so many people talk about the menopause, I know it's bad for my bones, brains and hearts. I'm really worried about that side. And then it's establishing who can help. And then it's looking at what are your options. And so before you think, do I go to my GP? Do I contact my breast care nurse? Do I contact my oncologist? Is thinking, what toolboxes do I have that are available? And then thinking, who can help? Shall I go into some of those toolboxes?
Yeah, go for it. Yeah.
And so I think that pathway is very much, what am I experiencing? Understanding what your options are. And I think if people listening, and if they're healthcare professionals or if they're patients, they can go on our website, menopauseandcancer.org, and really look at all of the options that are available. So initially, it's identifying, am I a good candidate for HRT, hormone replacement therapy, or not? Because many cancers are good candidates for hormone replacement therapy. Blood cancers, many types are, bowel cancers, lung cancers. So it doesn't mean hormones, systemic or vaginal hormones, are always contraindicated. So that's a myth I'd like to bust. Many, many people really benefit from having their hormones replaced after certain types of cancer. Not for all, but after many. And it's important to understand that. So am I a good candidate? Great to ask your oncologist when you're going through treatment, thinking, if this treatment puts me into the menopause, let's ask my oncologist what my options are. And then there is also a whole toolbox of non-hormonal treatment options. The British Menopause Society has a great fact sheet on non-hormonal options, alternatives to HRT. And they are medications that aren't necessarily licensed in the first place for menopausal symptoms after cancer. But as a byproduct, they can help with hot flushes, with sleep, with low mood, with anxiety, with some of the changes to maybe bowels, incontinence. And so that's really important to know, that maybe you've been told you shouldn't go on hormone replacement therapy. That does not mean your doctor can't prescribe you other alternatives. So I want to really show people that they have options with what their doctor can prescribe. But as you know from personal experience, as a cancer patient, you often also look outside the conventional treatment box, don't you? And people think, what about my diet? What about exercise? What about acupuncture? What about Reiki? What about cognitive behavior therapy?
Yeah.
And you know what? We have more evidence for the benefit of yoga, for example, for menopausal symptoms.
Right.
34 randomized controlled trials, in fact, than we have, I don't know, for some antidepressants, for example. And so it's important to think when you have that cup of tea with your symptom checker, is thinking, what do I want right now?
Yeah.
Because that is allowed to change as well.
Yeah.
You might think, I have no energy at all to do any of those lovely things Dani just mentioned in the complementary toolkit bucket. I can't get myself to acupuncture. I haven't got time for cognitive behavior therapy. I'm running on empty. You might think, maybe I need a non-hormonal treatment to help me first, get back on my feet, and then I might be turning up to yoga. Or it might be the other way around. And people often say to me, do you know what, Dani? I don't want any more medication. I've had so much chemo, radiotherapy. I don't want drugs. What else can I do? And then I want to say to people, there is lots of evidence for some non-hormonal treatment options in the complementary therapy bucket as well. Really empowering people that they have choice and that it's very personal to them what they might want to do. And you go for it. I don't want to share opinions.
Yeah.
This is right, this is wrong, you should have this. No. It's what do you think you can do for yourself? And it will get the positive sort of wheel going to help you feel better.
I love that that choice because, you know, we talk about this a lot on this podcast. You're taking control of cancer. You know, there is so much that every single cancer patient can do. Every single person who's a partner of a patient. There's so many things that we can all do, aren't there? To well, maybe not cure our own cancer. Obviously, you know, we can impact our lives and impact, you know, the way that we live and live better. Let's talk about HRT because you read things about HRT, particularly around breast cancer, and you've touched on some of the other cancers where it, you know, it is fantastic. Around breast cancer, what's the evidence-based situation in terms of impact on recurrence, its effectiveness? Yeah.
So let me ask you a question. What do you understand for HRT to be?
I really couldn't say it. I mean, my beyond like a literal definition of hormone replacement therapy, I wouldn't even really know.
Yeah, and that's so great because I think there'll be so many people out there who also think it's hormones. So we hear people have had an hormone receptor positive cancer, for example, and then they might think, I can't ever have anything to do with estrogen hormones, right? And so people would often write to us and say, do I now have to stay away from phytoestrogens in food or supplements because it's the word estrogen? And so people think that's the devil. But we really need to differentiate. So phytoestrogens in food are okay for everyone.
Yeah.
Phytoestrogens in supplement, where they're in concentrated form, many of the medical societies and menopause societies now say, actually, when you've had a hormone-sensitive cancer, best not to, but keep eating your soya beans and lentils and tofu and tempeh.
Yeah.
And then when you talk about HRT, there are two different types, and I think it's so important to make that clear. There is our local vaginal estrogen, and I really want to sum up what, because obviously I'm not the medic, but I want to share what all of the amazing doctors have sort of shared with us, and they always say, we must differentiate between local vaginal estrogen, which will help with a lot of the urinary tract symptoms, the vaginal symptoms, the vulval symptoms, the itching, the bleeding, the painful intercourse, so really debilitating symptoms. Women say, I can't cycle, I can't walk, I'm in a lot of pain, there is bleeding, my skin is tearing. Lots and lots of issues. Local vaginal estrogen can really help. And so that is a cream or a pessary or a ring that is just in the local area. People can put that on the vulva or inside the vagina. Lots of different treatment options can really help with those symptoms. That type of HRT or local estrogen doesn't go into your whole body. That stays localized, and that's different. And for most breast cancer survivors, that is very safe, even for those who are on treatments like tamoxifen. And now there is lots of evidence that it's also safe for people on aromatase inhibitors.
Right.
Now, but for those people, the waters are a bit more muddy.
Yeah.
So that's the only type. So for anyone who's had estrogen-positive breast cancer, treatment is in the past, vaginal estrogen, fine. For anyone after triple-negative breast cancers, local estrogen, fine, and also those on tamoxifen. Where doctors' opinion divides, and that's what I want to share with you, is doctors' opinions divide and guidelines divide a little bit as well, is for those on current aromatase inhibitors. Now, a latest big study from November 23, and we can put that in show notes for people to read themselves, has said that almost 50,000 breast cancer survivors, there was no risk of recurrence. And it's almost like just taking a systemic HRT for one day is for a whole year of local estrogen. So the dose is very, very low. And if those symptoms are persisting, they need treating. They don't get better over time. So it's important to think, is vaginal estrogen an option for me? And then systemic HRT, which goes into your whole body, is very different again. And that's why it's so important to think, just because my doctor said I can't have hormones back doesn't mean you can't have anything back.
Yeah.
So, and with the systemic hormone replacement therapy, our guidelines tell us, and many of the British Menopause Society, the American Menopause Society, they say it's not first-line treatment for breast cancer survivors.
Yeah.
And other non-hormonal treatments should go first-line options. But in some cases where women really, really, really struggle with their symptoms, they should have a conversation with their doctor, and it needs to be discussed on a bespoke one-to-one conversation. Some women might have survived cancer for 10, 15 years. They might go into perimenopause naturally, and they might want to know, what is my risk of going on HRT now? And then that's a very bespoke conversation between that lady and her doctor.
It's tricky, isn't it, when doctor's opinion divides? And,
so hard.
And because when you're a cancer patient, when you're, my situation, my wife had breast cancer, I felt like I wanted to be told what to do. I didn't want to have to make choices. Like you tell me, I don't need a menu of choices. You just tell me what you think is the best thing for me to do. But they don't really like doing that quite often, do they?
No.
So this comes back to the importance of understanding your own body, your own treatment. You're really becoming an advocate for yourself, doesn't it? Because I think, that's just massively important. And it seems to me with this conversation particularly, this is an area that women particularly who have certain cancers really need to get clued up on this, don't they?
They really, really do. For a long time as a cancer patient, but also as someone who now heads up our Menopause and Cancer organization, who's always in this space, I'm very used to sitting in rooms where doctors' opinions divide. And people quite like to think that they're right and the other person is wrong. But as the patient, and you yourself will know that, it tells us when doctors' opinions divide, there's only a few things it really tells us. There is no right or wrong. Otherwise, they wouldn't have different opinions. There is often no answer better than the other answer. The best answer is the one that resonates with you the most. So, for example, my first surgeon, who was proposing what to do about my double mastectomy, gave me a whole choice of how to wake up with expanders and this and that, and it was all too much for me at that time. So I went and chose a second opinion, and the surgeon I met, she was amazing. She told me what to do, and that's what I needed at that time, and that's what I did. I wasn't in this space where I could make choices for myself. I needed, like you said, someone to tell me. But when you're dealing with the menopause after cancer, it's often a late ongoing side effect. And it's often when people have moved out of the active cancer treatment and they're trying to repair their life and getting their life back on order, and they're thinking, why is it so hard? Why am I still feeling all of these symptoms? And my cancer treatment was over a year ago, and my whole family has celebrated for me to be cancer-free, and I'm returning back to work, and I haven't slept, and I've got all of these symptoms. When people wake up to then, oh my gosh, this is the menopause, they're often in a headspace where they can make more choices for themselves, where they can think things through a bit more, because you're a bit more removed from the active awful situation of just like you said earlier, I need to get rid of this.
Yeah, you're in the hamster wheel, aren't you?
Right, yeah. And then often years after, you're a bit more empowered to think, I'm now going to research my options. I'm going to listen to all these doctors, and then I'm going to do what resonates with me the most.
I've heard a few people talk about this on various podcasts, and it's before you're in the cancer world, I anyway had this perception of you get diagnosed with cancer, you go in for your treatment, you have your chemotherapy, you might have some radiotherapy, and you're given this mythical all clear, this amazing moment where you're given the all clear and you dance off into the sunset. And there's a big education piece, isn't there, actually? You know, we touched on it at the start, of all the things that can affect you post-cancer, and actually all the support now, not just menopause, but all the support that's available for people post-cancer, people who've had the cancer, their families as well. And it's a massive education piece, isn't it, you know, across all cancers, as to the impact, you know, going forward and what we can do about it now.
You know, on the one hand side, we're so lucky, cancer survival rates are improving, and at the same time, more and more younger people are getting diagnosed with cancers, and many of those cancer treatments will mean removing and stripping a woman of her estrogen. And when you think, I think by 2050, 16.3 million women would have been diagnosed with cancer. They will live with the aftermath of whatever it is, whether it's hormonal or the lack of hormones or other things, mental health issues. We will need to start addressing this because it's costing us billions, not just the NHS, but globally billions, when people don't get the help they need at the right time. And maybe, I don't know what it was like for you guys, but for us, it was very much, we felt we had to self-advocate. I felt the help I got was because of self-advocacy. And I want to argue and push against that now, because I was lucky, I'm educated, I have a supportive mother-in-law who told me to get off my backside and go and get a second opinion. And I had people to encourage me that I am worthy of living a good quality of life post-cancer. But most people don't have that, or many people don't have that. And so we can't let people having to self-advocate for themselves, because they'll just go down a rabbit hole. And so many people say it's much harder to live with the long-term effect of menopause than even the active cancer treatment, because that was done, like you said, you're hoping it will be done, whereas the menopause will go on and you'll struggle with it for the rest of your life in many cases. So it does deserve some help.
So how has the picture changed then since you've been involved in this world, even going back to when you were 30 and first diagnosed? How do you think the picture has changed in how much support's available, the attitude that your medical teams will have, the attitude kind of society has towards menopause? How's it all changed?
I think a great deal has changed, and it is due to some of these brilliant menopause warriors out there, that are on social media, and people who are going on the television and on reaching millions of people with the general menopause conversation. But what I always felt frustrated is that menopause conversation in general did not include and extend to us. I was so near it. I thought, you are talking about this affects me every single day, but you're not really talking about it. So I really wanted to include us into the greater conversation. And what that has done is it's really opened people's eyes, and that's a good thing. I think we're very far from knowing what to do, and a brilliant oncologist, Professor Richard Simcock, he's Macmillan's chief medical advisor, recently said to me, Dani, we have all of these millions of women struggling, and we have healthcare professionals perplexed at knowing how best to help them. I think this is true of where we're at, but we do know every change starts with conversation, and I think by being involved in that conversation, there is so much we can do. So I'd say to anyone listening to this, who knows a cancer patient, because we know so many, whether they're male or female, and we must touch on blokes in a moment maybe, is to say, gosh, I heard these people talk on a podcast. They say menopause after cancer is a big deal. What was it like for you? And so we might be able to open that conversation for other cancer survivors, just to enable them to reflect. And many people will say, actually, do you know what? Yeah, this has been bothering me for the last 5 years. I'm going to talk to my doctor, see what it's like.
You mentioned us blokes.
Yeah.
There's a bit of a bloke side to this too, isn't there? We spoke to a chap called Kevin Kibble in another episode of this podcast. He had prostate cancer. We talked about, a lot of the symptoms that you were talking about earlier in terms of the menopause. What is the picture for us chaps in the menopause?
And I don't hardly know anything about it, but I spoke to a really dear friend of mine who had a couple of cancers in his early life and then prostate cancer in his early 50s. And he came on the Menopause and Cancer podcast, and I said, Kevin, I really don't know what it's like for you. Tell us. And like you say, he kind of like mirrored our experiences. And he was explaining that some of the treatments for prostate cancer also try and strip him of all of the testosterone in his body. And that really is life-changing and life-altering. So when I talk about menopause after cancer and breast cancer for myself, it can change you, all of you. It can change you to your physical health, your mental health, and how you feel as a person. And he was saying exactly the same. And so I guess we have to extend the conversation to everyone, non-binary trans people, right? People, not everyone identifies as a man or a woman, so we have to be really careful of the use of words and making sure we include everyone. And I think the best thing is to ask the question. We're so worried, aren't we, to bring up cancer when someone is after maybe cancer, after active cancer treatment, or when people are affected with secondary cancer. We just don't know how to talk about it and what to say. When am I overstepping a line? When is too much? I want to just act as normal. We're treading around each other like on eggshells, but it's a really question to ask and to say, has your cancer treatment put you into the menopause? What was your experience like? And you just want to just hear what comes back.
And I guess as well, whether for a guy, whether whatever you label it as, if he's suffering, cold, hot sweats in the night, if he's suffering anxiety, restless legs, lots of the symptoms you talked about, lots of the same treatments, lots of the same therapies that you talked about would be relevant to him.
Yeah. And where it's a little bit of a disservice to all patients at the moment is hormonal health doesn't really feature on any questionnaires when you've completed your cancer treatment. There are health questionnaires. Sometimes the cancer nurse specialist will sort of say, well, now we're going to see you in 6 months. Let's hope you stay cancer-free, or let's hope your treatment as well, and we see you in next checkup. And all of those symptoms to do with the menopause don't feature on these questionnaires. We don't ask women about their sexual health post-cancer. Yet we know 88% or more than 8% of women will struggle with all of those symptoms. Right. More than 88. Talk about sleep. We talked about that a little bit before we pressed record, didn't we? 40 to 60% of cancer survivors will still struggle with ongoing sleep problems 2 and more years after their active cancer treatment. That's a long time.
Wow, yeah.
And 40 to 60% of all menopausal women as well. So you put those two together and we have a whole bunch of people out there struggling with sleep, sexual health related problems. But when no one asks you, as part of your cancer team, you are going to think it's just you.
Yeah.
And then what women then say to me is they say, well, Dani, I think I should have been coping better than I do. Maybe I'm not strong enough. Maybe I haven't done everything there is to do. And so we not carry around just with ourselves this suitcase full of symptoms. I have carried around with me a suitcase full of self-care burdens because I thought the responsibility was mine. And I don't want to point fingers or blame, but I think from now onwards, can we share the responsibility, please? So if we all chipped in, doctors, oncologists and surgeons, by adequately preparing us, by us patients, by thinking, okay, what are my symptoms? Because the clearer I am, the better my doctors will be able to help me. By policymakers, by people that fund charities and other places, we don't really need to reinvent the wheel. Some of the help is there. But we do need to do better collectively so that we can share that burden, so that we don't just think it's me.
And one more group to chip in, I guess, or a kind of one big group of partners, families, friends, colleagues. How can we share that burden as well? What can we do to help?
I think it's extending the conversation in general, and you'll know this more than anyone else, is that when active cancer treatment is over, the journey is only beginning, right? We know that. And whether it's in the workplace, and there are people who have survived cancer and are living with the effects of the menopause for years and years and years, is by not putting a lid on that box and never talking about it again. And I think that really should resonate with a lot of people in HR, in really making sure that there are systems in place that we can support people in the long run, not just when they're going through it. And again, it'll be conversation.
That's such a good point, isn't it? I imagine this impacts your work life an enormous amount. Yeah.
Today Wednesday. Today on our Menopause and Cancer podcast, but whenever people will listen to this, I have a whole episode on the lack of confidence.
Yeah.
You know, we talk about these symptoms as if they're just symptoms, but these symptoms impact someone's daily ability to get through life.
Yeah.
Really. So when we talk about brain fog, for example, it's not just brain fog. It's not just like I'm forgetting my words.
Yeah.
I want to do a good job here today, talking to you and our audience. I feel very anxious a lot of the times that I might forget my words, because it's not just I might forget my words. I have no idea what we were just talking about.
Yeah.
I might not be able to remember your name.
Yeah.
It's not just putting the keys in the fridge. I know people that have forgotten their dogs in the car for the whole day and they felt awful.
Yeah.
Awful, awful. We know people reduce their hours at work. You know, these symptoms are huge. And then the lack of confidence is also huge. We know people feel like less worthy at work. Often women at their prime, when they have worked so hard to get to where they are. And then that little voice in the back of their head might chip away at their confidence. They might think they have lost a lot of their self-worth. And we then draw back. We don't feel as social anymore. We think we're boring.
Yeah.
I thought no one is ever going to want to sit next to me at dinner parties, ever, ever again, because I was become so boring. And it was my lack of confidence. I just thought I had nothing to offer. I wasn't drinking anymore. I turned vegan. Nothing I need to advocate for, but it was just my choices, and I changed my mind many a times in all of the years. But at times I thought, well, now I'm not dancing on tables, knocking back vodka shots at 3:00 in the morning. I'm no fun.
Yeah.
But it was like a huge sort of lack of confidence in many, many areas. And actually, quite a few years ago, I had a book deal with an agent. I worked very hard towards that, and I signed it. It was a huge achievement. And I withdrew 6 months later. And now I know it was my lack of confidence, my ability to see that I had something worthy to write. And I ended the deal before even going for it. And so I do think it's really important that we get the help so that we can return to normal, should we want to work, with confidence, with the clarity in our brain to get through a day. I think we deserve it.
I'd read your book, Dani.
Oh, you're so sweet.
You definitely should write that book. So is it down to policymakers then? Do they need to give, I'm thinking of small businesses, more support so that they can offer the flexibility to their female employees if they're going through something like this? Is that where we need to get to?
Yeah, I think there are lots of menopause strategies for workplaces in place already. When they now extend, and hopefully they will at the back of our conversation, to include people after cancer, to shine a little spotlight on that, to ensure they get the right support even years after the active cancer treatment. That's great. But I do think any change, any policy change will start by women need to be a bit more outspoken.
Yeah.
We need to be louder in our voices. We need to turn our rage, that menopausal rage, into a really constructive roar, because we know when women and people do that in general as a collective, and no one can do that on their own, it will influence how research is done. We need much more research on how cancer treatments impact hormonal health. Even with new immunotherapy drugs, it's very little research done on how they affect ovarian function. Well, that's crazy to me.
Yeah.
So I think we need to be louder and more collective, and women need to think, I have been a really good cancer patient, I am a really good cancer patient, and you're not a difficult patient by now wanting to have a good quality of life after cancer.
Yeah.
Women will feel that they're a bother to the system, that they shouldn't bother their doctor, but I want to say to them, it's okay to be a difficult patient, and in fact, please be a difficult patient, because you must tell your doctor what you're experiencing so that they start scratching their heads and thinking, all right, she's the 10th one this week.
But this is the important thing, isn't it?
Yes.
Now, actually, with the focus, we've talked so many times, and anybody who knows the world of cancer knows treatments are incredible now for all different kinds of cancer. So the focus now has to be much more on how we live with cancer and beyond cancer, isn't it? Because more people are surviving cancer, more people are living longer with cancer. And I think we have to focus a lot more on actually how we do that.
And when the time is right, it'll be okay for everyone to sort of own their power and step into their power a little bit. And, I know it from myself. At one point, you might just want to put a lid on and move on. And you don't want to talk about cancer all the time. And you don't want to still go to your doctor and talk about symptoms. But if symptoms do linger and if they persist, and if someone is listening thinking, oh, could that be to do with the menopause? I haven't slept in donkeys of years. Or is it something else? Then do go and ask. Because if it bothers you, it should really bother your doctor. But if we don't tell our doctors, they can't help us in the first place, can they?
So is that the big message, one thing to sort of take away from this, that if you're somebody going through these symptoms, go and see somebody because there is something they can do?
Yeah. I think people go on a journey to sort of wake up to what is this life? What is my life now? Who have I become after cancer, right? Because the old you is gone. Yeah. There is no more old Dani. I was looking for her for a long, long time. I was like, where is she? She's in there somewhere, but I've changed as a person. And all I wanted is the old Dani back. But actually, I was moving away from the old Dani. Cancer changed me. It breaks you and puts you back, right? But it puts you back in a different way. Yeah. Like I'm still that same jigsaw, but I have pieces missing. They're gone. I don't know where they've gone, but they're gone.
And a few new pieces too.
And a few new pieces, right? So it's like a patchwork of a random jigsaw now. But it's important to recognize, who am I now? Who have I become? And step into your power. Listen to the Menopause and Cancer podcast, because sometimes things will fall into place and you're like, oh my gosh, yes, this has happened to me. And it's like little light bulb moments. And then when you think, do I want to act on something? Go for it. Go for it. Please don't think you have to suffer in silence. It is a collective problem. Millions of women are suffering, and you're not alone.
And you've got, 140 odd episodes you were saying of your podcast?
I know. So we talk about everything, really, from medication all the way to meditation, from sexual health to bone health, everything in between. Because the symptoms are so varied, and because I don't want to impose on people what they should do about those symptoms. I just want to say, let's look at the evidence. People want to know, can I take collagen for my joint ache, for example? And I say, I have no idea. Let's find out. And then we go and look for a great expert who can tell us.
Perfect. I think that's a really good place for me to point people to, because we've done 45 or 46 minutes of conversation here, a bit of a whistle-stop tour through the menopause. In 140 episodes, I'm sure there's an answer or if not an answer, a solution to most problems that women will face, I think, and it sounds like a pretty good resource to me. Dani, thank you so much for that conversation. I feel, and I'm slightly guilty that I didn't know half of that to start with, but hugely grateful to you for sharing it all with us. Thank you so much.
Thank you. Bye.